Thank
Hi,
you.
everybody. My name is Alyssa. I am a current student at the University of Minnesota in their Master's of Public Health program, and doing this work as part of my master's project. So, set to graduate in May. And this is the data that I put together. So, I'm just going to share my screen. Okay, can everybody see that? Okay.
Yep.
Okay, perfect. And I'm going to turn my video off so you guys can focus on the slides in case we get a little fussy stuff going on over here. So these are the results of the survey. This presentation is put all together in one section, but for the second presentation, the bottom portion will be separated because that's just relevant to this committee. So the first category was type of organization or organizational information. So this is how the data split up this year compared to 2024 and 2021. As you can see, there's a big jump in responses from local educational institutions, and also a big jump in tribal responses. This is what it looks like. And these were some specific job titles and roles of the people who filled out this survey. And then the next question was, do you work directly with families? So a big jump in 2026 compared to 2024 in the people who work directly with families. In 2024, you're at about 50%, and this year closer to 70. And then these were some of the roles that people do when they work with families. They fell into kind of these categories, so kind of simplified into these roles. And then we split up the number of home visitors by the type of organization. So you can kind of see this was by count, total count of responses. So a large portion in the 1 to 4 home visitors, and then 5 to 8 was the next largest category, and then 13 plus after that. And this is how it splits up with the different organization types. And this one is what best describes the amount of time your position is dedicated to home visiting. So there was nobody who selected part-time home visitor only. The 3 choices were full-time, part-time with other duties, and part-time home visitor only. And this is how it split up. So majority of the responses were part-time with other duties, and this chunk, 40% almost, was full-time home visiting. And this is how it splits up based off of type of organization. So you can see kind of almost an even split in local public health, nonprofit, a little bit more part-time than full-time, and then fully part-time, and fully full-time. This was the split up for the question, is your organization currently a Minnesota Department of Health family home visiting grantee? So pretty similar percentages in 2024, a bit higher than it was in 2021. These were the different types of program models that are currently being operated. This one was calculated by the percent of the total number of surveys, because it was a choose all that apply, which is why the percentages equal more than 100%. So these are how that played out, the highest being this other home visiting model program, which I'll show you what those responses were on the next slide. This one was the second one. And this is how that data, or sorry, one more slide. This is how that data looks like compared to the previous years. So this is 2026, this is 2024's data, and 2021. And I'll just give you a second to look at that. You know, there's a lot of information on that slide. And these were the other program models that were mentioned. And we wanted to check with you guys if any of these are repeats under different names or kind of under the same umbrella term. So if you see any that are repeats, please let us know so that we can remove them. Or if there's a better term that describes, a better umbrella term that describes multiple of these programs, let us know as well.
Mm-hmm. Alyssa, I'm wondering, can I see that first, that slide right before, just so I can see?
This one?
Yes. Yes. Perfect. Okay.
I would say, Alyssa, our sensitive parenting support program, that's a St. David's program, and that's also a promising practices program. So it is hitting two buckets there.
This one.
Sensitive parenting support program also falls under promising practice.
Okay, I will update that.
I can also share that, assuming some of my staff actually did fill this out, some of my staff are using Mothers and Babies and some are using Circle of Security. So, so they might be the same people.
Yeah, I am curious about Circle of Security being a standalone. I don't know of anyone that's doing that as a standalone. That's usually a supplement to other home visiting. So that's interesting.
Well, we offer Circle of Security classes, but every once in a while it's really helpful to be able to do it one-on-one with a particular parent. So.
And that's done, is that done through ECFE or is that like a separate? Okay.
Done through ECFE. There are many, many agencies in the Duluth area that are using that model for different reasons. Tons and tons of people are trained. So it's helpful to have the same language when we're working with families.
Mm-hmm. And then my second question is, I know on the first slide, we have a category that is for evidence-based programs, and then I see evidence-based quality intervention practices. Is that a model or is that just a series of practices that are used, in the implementation of a home visiting program? If anyone knows. Okay. I'll do a little digging. And then my final question is, and Jen, of course, it's because you're on this team, but should we be pulling out ECFE not as an other, but as its kind of own, as its own thing? Is that something we want to do if we're making that intentional inclusion? Should we continue to center it that way?
I think so, because every ECFE program in the state, every school district has or hasn't the ability to have ECFE. They can also levy for ECFE home visiting dollars.
Mm-hmm.
Not everybody does. Not everybody has qualified staff. So I think this would give some little more legitimacy to those out in the field who are not doing it and are thinking they should or could, or I just think it would help strengthen some of our ECFE programs if they're using home visiting as a parent education strategy.
Wonderful. Thank you. So Alyssa, then could we pull out the data from ECFE into the wider graph? I know we have a lot and we were trying to not make it super convoluted, but I do think that having the ECFE would be beneficial. Just because I agree. And it's a little different. Like the funding streams are different. The implementation is different.
Yeah, definitely. I can do that. Is there any other ones that you want pulled out, or is that the primary one from this list?
Did you share already, maybe I wasn't listening, how many ECFE people did fill this out? Or is that coming?
I didn't count specifically.
Okay.
No, this was the fill in the blank for that
Okay.
option. So people filled in the blank, the ECFE.
Okay.
But I can go back and count and I'll update this chart with the count for that.
Or just send me an email. I'm just super curious.
Okay.
Wonderful. Thank you. That sounds good. I might send you a note later, Alyssa, about the EQIP, that evidence-based quality something, just so we can figure out which bucket, if it goes in the evidence-based bucket or if it goes in the other bucket. So
Sounds good.
thank you. All right. Thanks.
So the next question was, when do your home visiting services typically begin? These are the answer choices: during pregnancy, postpartum birth to 8 weeks, or postpartum after 8 weeks. And this is how it's split up. So a large majority of them during pregnancy, and then postpartum birth to 8 weeks was the next biggest category, and then postpartum after 8 weeks was the third. And the next category is impact on families. So the first question was during home visits, what amount of time is typically spent on program requirements versus other concerns? This one was a fill in the blank percentages, and we split it up into categories of 10, so or 9. So this was the different category split ranges, and we did count then, and then a percentage of responses. So the largest category was 70 to 79%. And this was time typically, the full question was during home visits, what amount of time is typically spent on program requirements versus other concerns related to family issues. So this is how that's split up. And then this is what that data looks like compared to the other previous years. So 2026 is in orange again, and then this is what it's compared to 2024. So quite a big drop in percentage of responses in the 50 to 59% range from 2024 to 2026. That's one of the most noticeable changes. And then we asked them to rank their top 5 concerns or stressors you see with families, with 1 being the top concern. The way that these ones were calculated is there was a number value assigned to each response. So if they ranked it as number 1, it was worth 5 points, number 2, 4 points, number 3, 2 points, etc. And then with that, we were able to calculate the highest ranked. And that's the same for all of these that were ranked the top 5. So in 2026, housing and rent and employment income issues creeped up to 1 and 2 when compared to 2024. Housing and rent and employment income issues were 2 and 4. So kind of a big jump for housing and rent, and then also for employment and income issues this year. What have been the primary ways your organization has been able to help families with their current concerns and stressors? This one was a select all that apply, which is again why the percentage is higher than 100% total. But this was the number of responses. So child development was a big response, partnering with community programs, direct resources, and mental health support. And these are the other ways that home visitors were able to support families. The next one was the top 5 barriers you face addressing or resolving families' concerns and stressors, with 1 being the top concern. These were the exact same concerns as 2024. The difference between 2024 and 2025 was that we added top 5 instead of top 4, but the concerns 1 through 4 were the exact same as the previous year. And the next one has been, what has been the impact of federal funding cuts or threats to federal funding on families served by your organization? So the big one was mental health concerns, housing instability and rent, accessing public benefits was a big one too. So this is kind of how that data laid out. And then this was just another personal anecdote that was added in the other category. So if you want to read that. And the next category is impact of federal immigration operations. And I just want to give anybody a second to ask questions about the previous category if anyone has any questions or wants to go back to a slide.
I think it's great that we're going on to this next one because my mind is already thinking a lot of the results are an impact of that and why we're seeing just some of the responses were coming up that surge.
So these were the top 5 concerns or stressors we're seeing families experience related to federal immigration operation. Number 1 was fear of detention, deportation, family separation. Next was anxiety, stress, or other mental health concerns, employment, loss of income, which is what we saw in the other ones, and housing instability and difficulty paying rent was another one too, or loss of fear of accessing public benefits. So this kind of, like you said, mirrors the other results. And these are the ways that the organizations have been able to help the families impacted, and they were select all apply. So the highest ones were legal, referrals and services. Community outreach was a big one too, food assistance, and housing and rental assistance. These are some other ways that they were able to support clients with emotional support, information on rights, and switching from early classroom early childhood to home base for those who are unable to leave the home. And then these ones, all of the questions that were rating scale, we did a sliding scale and then a star with the average response. So this was calculated by assigning a number value to each of these and then dividing it by the number of responses. So this star represents where the average response landed on the line, and then this is how it how the data plays out. So a large number of the responses right around moderately successful, another chunk very successful and extremely successful. That pull that average up a little bit higher. So this is how successful you believed your organization had been in helping families with their concerns or stressors.
And Alyssa, I just have one question. I can't remember from yesterday. Is that was based has been helping families during the increase of immigration enforcement or overall?
This was overall.
Okay, thank you.
Yep. Yeah, the way that the questions were organized in follows exactly the way that the questions were organized in the survey. So it was kind of like a weird little jump. And then this is overall how they believe the organization has been. And the next category is impact on home visitors. So again, I just want to give anybody a chance. If you have any questions or want to go back to a slide, let me know.
I'm curious to know what folks have felt like has been the most important or like, really juicy thus far.
I think I'm just really interested in what home visitors are seeing are the stressors and then how home visitors are feeling either empowered or disempowered to impact those stressors. And I think I'm just sort of thinking ahead to the quarterly meeting and thinking that there could be like a lot of really interesting discussion that comes out of that around how are we understanding family stressors and how do we think about what's in our scope to support.
I like that. I'm writing that down for the quarterly meeting. I think we're good here. Thank you.
So the next category was the impact on the home visitors specifically. So we asked them to rank their top 5 concerns or stressors they're experiencing, with 1 being the top concern. And we just wanted to highlight the big change. So from 2024, it was kind of focused on burnout, mental health needs experienced by both the home visitor and the parents as number 1 and number 2. And we've seen a large shift where family safety and well-being is the number 1 concern and stressor. Second is reaching and contacting families, with burnout moving down the line to number 3. And then these were the primary ways your organization has been able to support its home visitors with their current stressors. So kind of a lot of responses for training, professional development, support and team collaboration. Reflective practice was a big one, and supervisor support was another big one. And these were the barriers that you face addressing and resolving home visitor concerns and stressors from an organizational standpoint. Big ones were complex of families, limited time, and insufficient program funding. And these are some other responses. So some staff or home visiting advocates are focused on teacher retention policies and this administration's lack of knowledge on what our program does and how it benefits the education system long term. And the next one was, how successful do you believe your organization has been in helping your home visitors with their concerns and stressors? So average response, very similar to the previous one, right above moderately successful, and this is how that broke down. So large amount of responses and moderately successful and very successful, some outliers and not very successful, not at all, or extremely successful. And this is how home visitor related stressors are impacting your workforce. So these are the option choices. A large number of people chose other and filled in an answer, which we'll show you in the next slide. But then second highest was staff showing noticeable signs of burnout. So these were the general other responses and their general categories. So general stress, no staff members exclusively designated to home visiting, small staff numbers, hiring freezes, staff members feeling underappreciated, budget constraints impacting hiring, and there were some responses that it's not impacting their workforce. So these were the primary partners your organization has received support from over the last year. This is kind of a limited data set in 2026. There, as you can see, there was no response from County Human Services and Social Services that completed the survey fully. But this is how that data spread out from these different types of support, partner support. And then these are the different categories. So the blue is local public health, the dark blue, the purple is local educational institute, the light blue is tribal, and the orange is nonprofit. And then we have a comparison for 2024 for this one. I'm going to switch to the next slide. We couldn't do them back to back just because of how many different categories there were for this question. So take a mental snapshot, and then this is the next one. So in this year, 2024, there was no one from local educational institution that completed the full survey. So there was no matched pairs for this data for that category, and same with tribal. So this one, the primary responses were County Human Services, local public health, and nonprofit. And then this is how it played out with the data. And then this is impact of federal funding cuts or threats to federal funding on your organization. This one was a select all that apply. There's no comparison to last year because this is a new question that we added. The top response was delayed program expansion or creation of new initiatives. And then there was a three-way tie between the next three shifts in organizational priorities, a reduction in programs or services offered, and additional grant applications to secure new funding. And then fifth was longer wait lists for services. And this is how the percentages played out, percentage of responses who selected that answer. The next one was three more useful forms of support your organization has received. So reflective supervision at 63% of responses selected that one. Physical resources for families was 55.6%, funding 40%, 40.7%, and then informational resources tied with that one. And these are just some personal anecdotes that people filled in about anything else that we should know regarding the needs and supports of your organization, family home visitors, or families. They are kind of wordy. There's 2 slides of them. So when we send out the slide deck, you guys can read through that as well. I'll just pause for a minute on this one and then I'll go to the next one. And then this is the next one. And again, we'll send this out so you have a little bit more time to read it too. But we just wanted to give you a minute to look it over. And the next category is feedback for the coalition. And I can pause here if anybody has any questions or comments about the previous slides.
I think
so are you an active?
Go ahead, Alyssa. Go ahead, Alyssa.
Sorry. Next category. So the first question was, are you an active participant in any of the following activities? So majority of responses are not an active participant in any of the activities. And this is how the other responses played out. The top 3 reasons that they engage is professional development was the number 1 response. New learning and educational topics was the 2nd response, and then working and learning from peers around the state was the 3rd. And then this, the next slides all answer this question. So each one was a different priority, and we have a rating scale for each of them too. So the first one was amend the Minnesota home visiting statute, and this is where the average rating was. It came out to be about 4.38. So I'm gonna give you numbers for this one too, just because it's hard to quantify this visual, but that puts us right above very well, kind of between very well and extremely well. And this is how the answers played out. So a good portion of responses selected not applicable, but a large number of responses selected extremely well, very well, and moderately well. No one selected not at all well or not very well for this one. The next one was protect and improve access to current investments for pregnant people and infants, including home visiting services in Minnesota. The average response for this one was 4.39. There was some outliers at the not at all well, a couple people that selected not applicable, and a large portion of responses that selected extremely well. The third one was protect and improve access to state investment in infant and early childhood mental health services. This average response was 4.61, so very close to the extremely well. Large number of responses selected extremely well, as you can see. A couple selected not applicable, moderately well, and very well. No one selected not at all well or not very well. This next one was increased funding for community solutions for healthy child development grants as a strategy to support mental health and well-being of families by promoting culturally appropriate and accessible services for families of color in Minnesota. The average response for this one was 4.23. A couple of responses in the not at all well, a couple in not applicable. Majority of the responses in extremely well for this category as well. And the next one was increased flexibility into types of home visiting programs eligible to apply for home visiting funding at the Minnesota Department of Health, Department of Human Services, and Department of Children, Youth, and Families, and or Minnesota Department of Education. The average rating for this question was 4.14, so just slightly above very well. A large number of responses in the not at all well, or extremely well, and a couple of responses and not at all well, not very well, and moderately well. That pulled that average down. A good number of responses in the not applicable for this question. For this one, support efforts to diversify, sustain, and retain the family home visiting workforce in Minnesota by exploring and expanding billing and funding opportunities for Minnesota or for family home visitors. And the average response for this one was 4.18. So again, just very slightly over the very well. And this is how that data looked. The next one was expand and increase compensation for home visits by trained or licensed professionals and paraprofessionals, including community health workers. And this is how that played out. So the average response for this one was 4.05, so almost exactly on the very well. And this is how that data displayed. Respond to emerging issues impacting home visiting services and public health investments for pregnant people and infants. The average rating for this question was a 4.23, and this is how that data played out. This one, how well do you believe the executive team represents your needs? The average rating was a 3.93, and this is how that data looked. So the majority of responses selected, I'm unsure, but would like to learn more. So that's what this bottom one is. Then this is how the other responses played out. So very well was the second largest category, and then extremely well, followed by not at all well and not very well. The next one was how well do you believe the executive team represents your needs? And I just compared 2026 data to 2024. So in 2026, we see kind of a big shift in this very well and extremely well categories, taking up the majority of it. Where in 2024, there was a lot more moderately well and less very well responses, and less extremely well too. So improvement from 2024. These were some feedback that people who filled out the survey provided. So I can just give you a minute to read through that. And again, we'll send this out. So if you want to read those responses more closely. And this is the final slide as well. Okay. Anybody have any slides they want to go back to or anything else that you want to see again with this section?
Just a comment and just a wondering, I think for future surveys, I'm just thinking about these last couple of questions. We push this survey out, and I think we try to get responses and push it out to people who probably have not had interactions with the coalition before, other than maybe a training here and there. And I think it's nice to have this other feedback to give a little context to that. Like, I don't even know who the executive team is or what they do. And some just know us because they attended a training once. So I just want us to hold on to that, and think about it, and also think about, is there a follow-up question for those that say not very well or not well at all, to kind of ask a follow-up question around, can you help us understand why you answered that way? I'm wondering how much of that is because you really don't know what the coalition does. Yeah. Or you haven't been as involved. I don't know. I'm just curious, and maybe it's a little defensiveness on my part, but just thinking, what is the context of some of those responses so that we can improve in those areas. It's hard to get that and not know what that's about.
I had the same thoughts, Paula. I feel like there's a lot of, especially school-based, people that maybe I or an Effie would have sent this out to, wouldn't even know that we exist, but I think there's a lot of usefulness for the trainings and for information and knowing that there's advocates for home visiting doing this work. So I just think it's a growth focus for us. And then I think about early childhood special ed. They're in homes every single day. They're home visitors too. So that's a whole other group that I wonder about.
Yes. Are there more slides, Alyssa?
And nope, that's it. That was the
Okay.
last slide.
Okay, well then my comment was going to be, I had noticed that in the first time of looking at this, my question is similar, Paula and Jen, to what you're saying is like, how are we defining participation? Because there are people like, yeah, I don't participate, but they do come to our quarterly meetings and then they've used our other trainings and it's like, well, that is, you know, from my perspective, I'm like, oh, for me, I'm like, yeah, you're part of the team. And so part of me is wondering what, there's a disconnect there. And then again, also then wondering, there's a desire, it looks like, to learn more about the executive committee. And so how are we highlighting your work? Because we do have so many different kinds of programs on our executive committee. Like you do incredible work. So how are we making sure you all are getting the flowers as the leaders you are in the field? So a lot of opportunities for us to, I think, to have some more conversation. Okay. And Laura, I saw you've joined. Hello. Welcome to the party.
Thank you.
Okay. Do folks have any other reactions? Pat, you're unmuted. I don't know if that's because you're unmuted or because you're ready to jump in.
No, I've just remained unmuted because I always forget to unmute myself.
That's brave of you.
Can I just comment also? I think I agree that that it, people who are responding may not always know like like they don't have this in-depth connection to the collaborative coalition. So it just is it's helpful for us as leadership, as executive committee members and as contracted staff to really help think about our what we are communicating. People called out the newsletter, the importance of that. They called out the training. Some people think we're the Department of Health. Um, so there's just this whole range of like people's interaction with the coalition. And uh, it's kind of the beauty of it in some ways. Like you're in because you want to be in, but helping people understand like what in looks like or how, like, what are the touch points might be really useful. Um, and even Kathy and I and Alyssa were talking yesterday when we were going through the results again. Oftentimes, Kati or I will play a more significant role in our quarterly meetings. And maybe, we've been working to shift that, but I do think it's important for people to hear from all of you and have those connections. You are their people. We are here to support you all. So I do think that is something for us to be considering too, like, when we have these quarterly meetings, when we do the trainings, like I'm trying to head up to Duluth June 11th, got invited up, like making sure people know we're going up to we're going up for a Thrive meeting, Jen. Um, so, um, but making sure those connections are made, like who else in the region are we working with, and making sure we're paying attention to that when we're out and about and instead of being the face of the coalition. We need to all kind of share that, I think, is what it's kind of my takeaway from looking at the data again.
A thought that I have too is, and I mean, you all have amazing perspectives, and we just had the Manafi conference where that can be a captive audience. We can promote the coalition and do some training and do some, like, here's how we are representing each other and really families in our state. And so I think next year that would be a great thing for us to make sure we're offering some form of home visiting training session.
Yes, I thought of that too late. And so any time that you could like flag that, I was literally like, oh my God, of course we should have tried to be there.
Yeah,
So
next
because
year.
we don't have like Head Start has they have a statewide conference. ECFE has or Manafi has one, but there's not one for home visiting in general. And
Mm-hmm.
we've talked about that off and on. So we should go to where it is happening. Oh,
See you,
goodbye.
Olivia. And I come from a view where, and I say this all the time, I've chosen to stay involved with this group because it truly represents a wide area of the state. It's clearly not every area, but it's wide, and it's with ECFE and with different I want to call them belief systems. That's not the right word. Different curriculums, different approaches, different and I think that's why we have the reputation of being misconstrued as the state or whatever, is because we do bring these voices together. And so I think it's an important to promote what I would say is both sides. There's obviously more sides than two, but the side of the executive committee that's made up of people in the field, people from the counties, people from, private nonprofit organizations, all of that. But I think it's also important to say we've teamed with Laura and we've teamed with Kati and we've teamed with, the advocate work that we do legislatively and stuff. Because I think that it's a nice combination that's somewhat unique, especially now, you know, in these times of budgets and all of those kinds of things. So I don't think it's an either or. I think it's a combination of both. but I do think more continuous promotion or more continuous education maybe is a better word. I could use propaganda, but that would sound terrible. About, who is the executive committee and what's the role and all that. I do think that's helpful.
And I'm going to use propaganda in the notes. I really like that. But and perhaps like a simple way I'm thinking is, as we're asking you all to facilitate a different meeting, can we use that as an opportunity? Do you have 5 minutes to talk great about your program? Just to really beef up kind of like that introduction, um, I think would be like at one way for us to immediately start doing that. And so, Jocelyn, I already have you written down to facilitate their summer quarterly meeting. So woohoo! So I'm glad you're still on board. You weren't like shaking your no, I'm gonna be out of the country or something. The last question I have about this survey, well, it doesn't have to be the last one, but the question I have now about this survey is, we would love to have this presented at our June quarterly meeting. And when it comes to kind of the presentation, do you have any feedback about that, about kind of like the data, that kind of part of it? My thought was, can we separate out like, okay, this is the ICE section, just kind of like really making it clear. This is the ICE section. This is like the coalition feedback session. This is the emerging issue section. So that was just one thing I had, just kind of make it clear, but wondering if you all had anything or if there was a section you really did like that you would like us to linger on. I think that's also great too.
I'm wondering, I'll be curious. I feel like I remember from the last year, the last time we did this, when we presented it at the quarterly meeting, there was lots of people saying, "Oh, I didn't answer that. Is there still time to answer that? Can I do that?" I'll be interested to see if that happens again. And if it does, like, do we consider putting it out and branching over the quarterly meeting and saying, does anyone want to take 10? Well, it does take longer, so that's the problem. But to give people time to respond, or, after that time, I don't know if we've been able to do that, to say it's out right now. We're sending the link again. Yeah, I don't know what the best way to do that, but just thinking about, I remember that being like, oh, yeah, there's missed opportunity here. And these are the people that are attending and could probably speak more to it. But I'll be interested. I have a feeling, if I'm a betting girl, I think we're going to hear some of that again. Yeah.
I had two thoughts. One, Paul, I think probably you're right. And there's gonna be people like, oh, I didn't see it. I don't read my emails. I mean, I missed that email. And I think I wonder if it could be helpful at certain places to be like, as we have the data up, to be like, people who are in the chat, if you didn't get a chance to answer the survey, can you let us know with this reaction if this broadly agrees with your experience, or this reaction if this broadly disagrees with your experience? And then people feel like they have an opportunity to make their voices heard without us needing to necessarily send the survey out again and recalibrate all the data. I don't know if that would be helpful, but I think a lot of the people who say that really just want to be heard, and I think this would allow them to feel heard. Um, I'm also wondering, just because I know we have limited time when we're all together in the quarterly meeting, maybe this is similar, Kati, to your question, but like, is there a question that we as the executive committee or we as a coalition have based on this data that we particularly want to get more in-depth qualitative feedback on from coalition members? And then we can really like dive deep into that section. Like, are we primarily interested in what are the needs of home visiting and how do we figure out about how we like advance those? Are we particularly interested in how are people engaging with the coalition and how do we advance that? Like, and I don't know, but I wonder if people might have more robust and helpful discussions in small groups if we're able to help them narrow focus a little bit.
Laura, what are your thoughts to that about like the, I know I'm like, because me, I'm like, yeah, let's bust open the survey again. Oh, I
Yeah,
forget the
no,
worded.
no, we cannot.
Let's open.
Alyssa is done with her commitment. But I actually do like the idea of just asking some questions. And I wonder um if we could do the results and then do breakout groups and have discussion about the different sections of like what we're hearing back. Because I will say, I will say I've had some additional follow-up conversations with our friends at the Department of Health again about funding and just saying, I don't get this. Like this makes no sense to me. So there's another commitment by some leaders to try to set up a conversation. And I actually think some of the findings in this survey would be really helpful for them as they're thinking about capacity building, as they're thinking about their role at the state. And especially as we think about, the coalition has been playing this role across different types of home visiting service delivery programs that there's real value in learning from one another and meeting the needs of families in different ways. So anyway, I think having a couple of discussion questions either at the end of the full survey or in and have everybody kind of go through them, but specific to the different segments of the survey findings. And then I think the evaluation stuff should be totally separate because I think it would be helpful for us to get feedback there too. But my sense would be to do the survey, the emerging issues, and then separate information on the coalition. But that's my thank you for asking, Kathy.
I also
I,
wonder if there's some opportunity for a little bit of education just based off of our wonderings of why did people answer that way? Oh, I bet they don't know. Or, oh, I bet they aren't sure about who we are, what we do. So there might be just some tidbits of like, we're feeling like there's a lack of information about this, or people haven't read that. So here it is.
Can I say one more thing? So to that point, um, I took a trip out to without naming this organization who's providing family home visiting in a model that they had a layoff. They have a very small team, so there was a lot of information lost when they lost their home visitor and then started a home visitor. So on that chart, they would have been in that one to two people, and possibly one part-time instead of nope, Alyssa, it was no one was part-time. Everybody was either part-time with other jobs, right? Alyssa, that's what that
Yep.
data said. Okay, thank you. But they didn't know they were funded from the Department of Health. And I'm like, oh, so I was like, oh, we
Right.
should make sure you're connected to them. And so this home visitor who wasn't responsible for writing the grant had no clue where the funding was and what other services they could connect them to, like the families to that they were serving. So I suspect this young person is not alone.
Mhm.
And so when we're asking people to give us their input, it's one person's input for the whole system, right? Like they don't speak on behalf necessarily. We didn't ask anyone to speak on behalf of the program, but we did ask people to speak out on behalf of their experience.
I
well, and
agree,
we
Laura. My staff had no idea how we're funded.
Yeah, yeah,
Yeah.
yeah.
and we talked about this before we did the survey. I mean, this comes up, I always think of Paula just because the work that we did and the work that St. David's did was so aligned. Do you give one person in your program the voice to speak for your program? You know, you have six home visitors. If they follow the 80-20 curve, right? Four of them are kick-ass home visitors, two of them aren't great. What if the two do that? So I just think I like the idea that was floated about saying to people, these are the general themes. And if you wish to respond to these general themes, we'd love to do that. not opening the whatever. Just if someone's motivated enough to be verbal, let's give them the chance to do that. But I think we also need to say these are the these are the aggregate results, and you're going to see voices that stand out within the aggregate, but we can only do, we all, every survey has its flaws, right? Every poll has its challenges. So I just think acknowledging that we're getting, I think, Laura, that's a great example. I don't know how many home visitors know or care to know or wish to even be quizzed on who the hell's paying for them to do their job. I think most home visitors would talk at a county level, and only because that's typically how they get their work assigned to them, or the five county area. I mean, counties tend to be the defining moments for some home visiting models, whereas, for ECFE or parents or teachers, it may be a totally different way of defining it. But I don't think the workers per se pay a whole lot of attention to that.
Okay. So what I'm hearing about, we'll for sure have when we do the breakout groups, because that was what we'll have the emerging issues results, ability to respond to immigration enforcement, and then we could do the coalition feedback as another one, as another group. Okay. Um, and um, and I'd love to kind of last thing for us to do here about this would just be to chat about what do we really want those questions to be about? Do they need to be separate for each category? Probably. Yeah. Laura, you have a question?
I do. I actually would like to, in it, because in addition to just calling it out as the immigration surge, I think it's also the other policy changes because the feedback we got could have been broader. It could have been really specific, but we're like home visitors are reporting that families are afraid to like seek public benefits and that they're afraid to, come out and of their homes. So I just think it's going to be important that we put them into both categories and maybe that feels like a bit of a cap out, but I think based on where you are in a rural Minnesota community, um, without grouping them, we're going to get a more limited response.
So I could say impact of federal changes, federal actions,
And
and
immigration,
immigration
actually,
enforcement.
yep.
Thank you. But we're talking about the impact on families specifically. Okay, wonderful. Okay, so then my question is, do you all feel comfortable with Laura and I drafting up some of these discussion questions? Do we want to spend time here taking it? Laura, what do you want to do? You want to spend time later or now?
Do you want us to draft something and then you can respond to them? Or would you like to offer
It
them up?
I don't have strong feelings necessarily. I think there's a lot of data in that
Mhm.
survey. And so, I mean, we could ask truly hundreds of questions.
Mhm.
And so I think, in some ways, again, given kind of time constraints, I would be most curious to hear from people, maybe like what has anything changed for them since they filled the survey out? And then also like what do they feel like, or what sorts of actions or investments either within their organizations or externally would be helpful in moving the needle on some of these concerns? I think those are the two big questions that I have, and certainly people will take those questions and go wherever their little hearts desire with them in a group Zoom breakout question. But like then I think that's what I'm most interested in, and then I defer to your judgment beyond that.
Okay, so if we draft it, so when we were going through the results again yesterday, there were just there are your perspective from doing this work and supporting those who do this work is very different than ours from people who support you doing your work, who you support doing their work. Um, so we're just far enough removed that we might not pick up on some of the nuance in a question. I really just want to hold up your expertise. So if we draft something, we really would like you to take a peek at them, if possible. And I have one more question for you. Would it be helpful if we helped create a bit of a script so Jocelyn, it sounds like you're going to lead the meeting on the 11th. Would it be helpful to kind of come up with a little bit of a script about like the questions of the survey, why why we started the survey? Because Alyssa has been able to get us the data, but the data alone is not the story. I mean, we want to tell the story of the data, instead of allowing people to create their own story. I think we want to have some ownership over the narrative of the story. Um,
Yeah, I would love something to talk about context and to sort of situate all of that. I was also hoping that maybe sometime in the next few weeks that you and Kati and I and Paula maybe could have like half an hour to just talk about
mhm,
facilitating.
mhm. Yep, absolutely. That'd be great. Alyssa, does any of this conversation create questions for you, and what we might need from you during the presentation on the 11th?
Not yet. I don't think
Okay,
so.
okay.
I know like we're talking about breakout room questions, and I don't remember who mentioned it earlier. But like specifically for the second or the last half, with the
Mhm.
rating scale for the people who commented like not at all well, not very well, like maybe giving them a chance to say
Mhm.
what they're seeing for that, and
Mhm.
why they selected that answer. Maybe in like the small breakout rooms, they're more likely to answer that so that we have more helpful data for that section specifically.
Yeah, and if we have an executive committee member in each of the breakout rooms, I don't think we'll see how many people we have. We could work with you to record your session and promise not to save the recordings in the end, but use it for note-taking purposes. Um, so many times when we're taking notes and trying to get them back, we might miss something, or it goes through our own lens, and it can be helpful to have a recording. Or does that feel like too much responsibility to record?
I
Like,
think it would, I like the idea of having somebody record. I think it would be nice to then, does double duty to get people involved with who executive committee members are if they're all in the breakout groups. I do know that there was, feedback around the executive committee in the survey, and so I don't know enough. I don't have a strong enough sense about who comes to executive committee or not executive, who comes to quarterly meetings. I would hate for someone to feel like they couldn't express themselves honestly if they know that an executive committee member is taking notes. The other part of me feels like if you feel strongly enough about something, you should feel strongly enough to say it to somebody's face. So I don't know what we want to do with that, but that's where I'm sort of like thinking about.
And in addition, if they feel strongly enough, they could join us.
Mhm.
We would love that.
exactly. Ooh, okay. So I love that idea. In the list of questions and information we send out to the other folks, I'll include that we would potentially like to have an executive committee member. Well, we know there will be. You all will be joining us. And that since there will be three, there could be a couple. So, to join either as a note taker or as to record. Okay. Any final thoughts on this part on the survey? Any closing thoughts? Lingering threads you haven't pulled on yet? Okay.
Can we just acknowledge, Alyssa, your work on this? This is just so helpful. We cannot thank you enough for saying yes to this as your um, master's project. So thank you. And it's the first time we've been able to like get data that we wanted. We have always just used the SurveyMonkey results, like how they pulled the data together. So when we started talking with Alyssa and she's like, "Oh, we can do this and we can do this," I'm like, "Oh, this is amazing. This is great." We've never been able to really pull like that trend data together and show it on a slide because we didn't have that expertise. So, Alyssa, thank you so very, very much.
Yes, thanks for having me.
Thank you.
And doing it with baby Luca
With
Yeah,
side by
Luca.
side.
that was the
It's
most
been great.
impressive part.